Hi, I'm Dr. Kathy from Educated Pregnancy, and today we're going to handle one of the most frequently asked questions we get on our website, and that is, why do children need to be adjusted by a chiropractor? Well, let's talk first and foremost about one of the most important structures in your human body, and it is the structure that was developed first in your developing child or in your own body as you were developing within your mother's womb. And that is your nervous system. Your nervous system consists of your brain, which is protected by your skull, and your spinal cord, which is protected by 24 movable segments of bone called vertebrae. Now, in this nervous system is a lot of delicate, very important tissue that is responsible for sending out signals to every part of your body and receiving signals from every part of your body back up to the brain that help to control and coordinate the function, the development, and the growth of every cell, every tissue, every organ, and every system in that human being's body. So whether that's your body or your child's body, the brain and the spinal cord are responsible for controlling everything. We understand as chiropractors that any misalignment in the spine can cause an interference in the transmission of the normal mental impulses from the brain down to the body and from the body back up to the brain. So think about your cell phone line. If you are on a phone call and you're driving through a tunnel and there's interference because of the tunnel and it's preventing your signal from getting out of the tunnel and to the satellite and then back to the other person that you're calling, you may have experienced where your call kind of does that and you may drop the call, or you may just lose the call momentarily and then it comes back up. Well, the nervous system, when it's being interfered with, functions in quite a similar way. You're still sending the signals, but maybe not 100% of the signal gets to its destination. Or the vice versa can happen. Maybe your body is sending a signal to the brain, but because there's interference, perhaps you only get 98% of the message sent to the brain, and therefore the brain has to make a decision of what to do based on 98% of the information rather than on 100% of the information. So when there is that type of interference to the spine and to the nervous system, those misalignments in your spine or in your child's spine are called subluxations. What chiropractors do is we detect and correct vertebral subluxations by using our hands to deliver a very specific, scientific, safe, gentle, and effective chiropractic adjustment. These adjustments will actually restore the bones into their normal position, which will allow proper communication between the brain and the body, and between the body and the brain. Now, how do these misalignments or subluxations occur in your child's body? Well, it's very simple. Have you ever watched your kids play? Have you ever watched them wrestle or fall off the couch or ride their bicycle or learn how to crawl or fall down as they're learning how to walk? What about your children that are involved in sports? Maybe they're tackling someone or they've gotten tackled. Maybe they've done a headbutt in soccer or fallen off a balance beam. All of these types of impacts to the human body can absolutely cause a misalignment to the spine. It can cause muscles to go into spasm, whether from exercise or from injury, which can pull on the bones that hold the spine and the muscles in place. And that muscle spasm, if it pulls the bone out of position, can create pressure on the nervous system. That pressure on the nervous system would then cause the muscle to go into more spasm, which would then pull the bone even further out of its normal position, creating more pressure on the nerve and therefore continuing that negative cycle. So as a chiropractor, our job is to look for those misalignments in the spine, figure out what is being interfered with and what symptoms that may be causing in your spine, your body, your child's spine or your child's body, and then correct those by delivering a very specific chiropractic adjustment, which again puts that bone back into its normal position, which will relieve the pressure on the nervous system, allow for proper transmission of the mental impulses, take the pressure off the muscles and allow the muscles to go back into their normal tone so that there's no more spasm there, which will over time allow the spine to remain in its corrected position. So while many people have the idea that chiropractic is just for headaches, neck pain, or back pain, and therefore think that my child doesn't need to go to a chiropractor because they don't have headaches, neck pain, or back pain, we understand that chiropractic is not just about symptoms. It is about maintaining optimum performance and optimum level of function in a human being. And if you want to experience the best level of performance for your child for the rest of their life, then I would recommend that you have your child checked on a regular basis by a doctor of chiropractic to be sure that their nervous system can function freely without interference from the moment they are born until the day they take their very last breath. If you have more questions, please visit your doctor of chiropractic or check out our website, educatedpregnancy.com.